Today's show is brought to you by Hometown Heating, Cooling, and More. We take pride in our work, guarantee it accordingly, treat every unit as our own, which sets us apart in the industry. Visit heatandcoolwithus.com. Thanks to Hometown Heating and Cooling. Also want to tell you about Drug Summit 7, which is happening tomorrow at the American One Event Center. It's from 8 a.m. to 3. Visit drugfreejackson.com/summit to sign up. It'd be a great event. Hear from area law enforcement leaders, hear from folks who have recovered and are on their way to recovery. It's Jackson Drug Summit 7 tomorrow at the American One.
Now with us is the Interim CEO and Chief Operating Officer at Center for Family Health, Sara Benedetto. Good morning.
Good morning.
Morning.
Good to see you guys again.
You too.
Good to be
Interim
here.
CEO, but your days are numbered.
My days are numbered. Not that I'm counting.
That's a good thing, right?
Yes, I'm very excited. Yeah, we're very excited to announce we have a new CEO joining us. He'll start May 30th. So his name is Bill Lepiski, and he's coming to us from Iowa at a community health center there.
Mm-hmm. He's the result of a long search to replace Molly Case.
Yeah, see, she's got big shoes to fill. It's
Yeah.
hard to fill her shoes. Yeah. She retired last March, the end of March. It's been almost a year. So.
Wow.
Yeah.
And it looks like Bill's originally spent a lot of time in Maine.
He did.
So we'll be able to talk about lobsters and
yes, exactly. I don't know. I haven't asked him about lobsters yet, but we'll see. Yeah.
Nice. And in the meantime, you've been essentially doing double duty as CEO and COO. You'll return to just being COO after
Yes.
Bill arrives.
Yes, it'll be a nice change. Yeah, but we have a great team. We have a great leadership team and a great group of staff. So it's made it a lot easier than it could have been, right? So
You guys are always and always innovating, always growing. You guys have plans to expand the walk-in clinic a little bit. Talk about that.
We do. The finished product probably won't be till closer to September of 2024.
Sure.
But construction projects take a while. So. We're working with Jason Cavell. He's doing a great job for us as we are finalizing the schematic drawings and to expand our walk-in. So we are kind of cozy, our space in our walk-in. So we'll be adding a couple of exam rooms, just making the lobby area larger, and the space that the staff work in. So
yeah, it's a busy place. It resembles Grand Central Station.
It does at times.
And with the you've upgraded to pharmacy equipment. You're going to be adding a drive-through, which I know your patients are going to love.
Yes. Yeah, same time frame is about the same. So what we'll be doing is we'll bump out the walk-in about 50 feet towards Ganston Street. Okay. And then on the opposite side of that will be the 2 pharmacy drive-up windows. It'll be much like a bank, It'll be a video monitor, so when the patients pull up, they can speak to the pharmacist because the pharmacy is actually on the other side of the building.
Wow. Interesting.
So the drugs, the medications will go up and over the ceiling, and coming out the other side. So we're really excited, and we're using some federal grants. Some of our COVID expansion or COVID recovery dollars are going to help us with that.
Well, then anyone be able to use that pharmacy?
Yeah, and actually anyone can now. And the pharmacy is available to serve anyone, whether you're a patient or not a patient. But we do know that a lot of folks would really like the convenience of not having to come in the building. And we do what we call curbside delivery now. So the prescriptions can be picked up outside. If you let us know you're out there, we can walk them out to the car. But
what do you prefer, to go in or drive through?
Well, I prefer to go in because I think there's something that's happening there.
Oh my God.
I think if you're there to stare them down.
I think you're out of your mind. I don't know what you're talking about. No. You guys have purchased some ADA accessible vans.
Yes.
What will those allow you to do with patients?
So that's been a challenge, as you probably are aware. Transportation is a big challenge for many of our patients that we serve, but especially if you add into the other barriers around ADA types of issues, folks that are in wheelchairs or have mobility issues. So using our COVID expansion or recovery dollars, we were able to purchase a van a pre-owned van, actually from the Jackson Ambulance, that's going to it has a lift on it, and
nice.
it's able to fit, I think, 2 wheelchairs, and then also the guest with the patient. So there's some seats that pop down.
Oh, that'll be very
So,
nice.
Yeah, we're
Yeah,
excited.
Definitely needed.
Yes, for
Yeah,
sure.
for sure. We think it'll be a
Well,
big help.
and now we've got all the school-based health centers up and
Yes,
running.
they're all open. Yeah, although a little hiccup today. I think that Jackson High was up without power, or at least a portion of it, the portion that we're in. So all of our school health centers are open and able to serve folks of all ages, whether you're in the school or not, adults and kids, mental health, medical health. So
I love the feeling stressed, sad, or just need to talk, and that's available.
that is available, and I'll tell you what's really good is that we're there to see the kids, but what's sad is that there's so much need.
Right.
Because our mental health therapists there's 3 currently, we have 1 vacancy at Northeast, but they're all very busy already. Some days even seeing more patients than the medical providers,
Really?
which is not
Yeah.
at all what we had seen in the
Yeah.
past.
Yeah.
So like I said, the good news is that we're there
That is
to
great.
help, and that
Absolutely.
kids are. And some kids just want a little talk for a little bit. That's why it's maybe you
Yeah.
don't want the mental health counseling or the full multiple appointments. You
Right.
just need a couple visits
Sure.
here and there, and that's certainly
Yeah, maybe
fine
you
as
just
well.
need to tell somebody something.
Yep, that's what we're there for. So
Yeah, especially if a kid has something going on at home, probably hesitant to let home know that they're.
Yes.
It might be easier telling someone at the health center than maybe a teacher as well.
Sure.
So,
it is, and a lot of times the kids will talk to the medical provider, and that provider can say, you know what, we have so and so, and she's really good at helping you. You might want to talk with her, and they'll connect
nice.
them up. So there's a lot of warm handoff there. That's really nice as well.
Not too late to get a flu shot, or it's never too late for a COVID shot.
No, never too late. You can come see us. All of our school sites. You can also get flu and COVID vaccines. Our downtown. You can walk in Monday through Friday, 9 a.m. to 9 p.m. and Saturday and Sunday as well on the weekends. So, yeah.
And I think people that had been on the COVID schedule, I think people have lost interest. It's like
Yes, I think you're right. And as we've seen the cases, the prevalence kind of decline. That's a good thing. But then folks tends to be out of your mind, and I think people are kind of have the fatigue of
for
hearing
sure.
about it. But we do know that people that are, particularly if you have chronic illness, chronic conditions like diabetes, heart disease, you can be still much at risk for a more severe illness. So
Yeah,
Still
and last
good.
week there were 12 people at Henry Ford Jackson with COVID hospitalized.
inpatient.
Yeah.
Okay. Yep.
So it's still here.
Yeah,
It's still
so
here.
It's the vaccine's available if you'd like to get it.
And flu season. When does the flu season officially end?
Well, there's no official. I wish we could just say, well, all the bugs
Soon.
just go away,
No more
right?
flu.
But
It's
it's
gotta be soon,
typically in the early springtime. Although it can still pop up here and there, but it hasn't been a terrible season.
It
for
hasn't.
that either.
It's been like a 1-2 day, at least what I've seen, that people have. So, but you of course had a 30-day
I've had
RSV
8
that
of
you're still
them.
complaining about. So,
Well, it just won't go away. It's lingering.
Just kind of
you
lingers.
still have the RSV from
I've-
December?
I think so.
I don't think so. I don't think it lasts that long.
Something.
just kind of leaves its effects there a little.
Yeah.
Age.
Yeah. it's-
But I think people are, because of COVID, they're maybe practicing better personal health habits
Yeah.
like hand washing and staying away from people when you're
I
sick.
think so.
I think after COVID, people are more apt to go get a physical or go get a flu shot or see their dentist regularly. I think it's maybe led to some more visits and some healthcare that people have just been kind of skipping in general. So,
Yeah.
just my opinion.
You're right, I think.
And it's important to get those preventive visits and to come in even
Yeah.
if you're not sick. Like you
Yeah.
said, we're doing a lot of work right now to bring folks back in that were not wanting to come out during
Yeah.
the pandemic, and so we're starting to see that. Yeah.
Great. Thanks for all the info.
Yeah,
Thank
thank
you.
you. Thanks for having me.
I look forward to meeting the new CEO when
meeting
he
Bill.
gets to town in
Yes,
spring.
in the spring. All right.
Sarah Benedetto, serving as interim CEO and permanent COO at the Center for Family Health. More of the morning show in just a couple minutes. Stay with us.